Vice Chairman Corbett, and members of the council, thank you for hosting today's meeting and in focusing on mental health in rural Georgia. My name is Abdul Henderson. I'm the Executive Director of Mental Health America of Georgia. We are an organization that focuses on training, advocacy, and education with a focus on early intervention and prevention. We are also a state affiliate of Mental Health America, our national organization. As Kim talked about, we are partners in many organizations. One is the Georgia Mental Health Policy Partnership, but the one I'm representing today is the Georgia Parity Collaborative. We all work closely together with organizations like the Carter Center, NAMI Georgia, Georgia Council on Substance Abuse, the Georgia chapter of the American Foundation for Suicide Prevention, and many others. We are a coalition of organizations that focus on parity compliance and enforcement as our #1 priority. I am also a former United States Marine and a combat veteran of the Iraq War. So I have personally been impacted by and have witnessed what mental health crisis looks like. I am here today to discuss parity and why it's important. But before I do, I want to tell the council that the delivery of mental health care in Georgia is in crisis. To be frank, and Kim said that the system is broken, I will go a step further and say the system is failing. It is failing Georgians that are in need of mental health care. Prior to the pandemic, there were strains on the system already regarding mental health. But as we go into year 2 of COVID-19 outbreak, the rise in demand for mental health services is crippling the system because of a workforce shortage, no parity enforcement, and in the past there has been a lack of will to make significant policy change to improve the system. You may or may not know, but Georgia currently ranks 48th in the country with respect to mental health care access. We were 51st, but Texas, Florida, and Alabama did so poorly with the delivery of services, we moved up 3 slots. This is not to be celebrated because Georgia didn't do much to make significant change on the policy landscape and how we deal with mental health and substance use disorder. Now let me take some time to explain what is happening on the ground in regards to mental health. Neighboring Dawson County, just to the south, has led the state in death by suicide for the last 10 years. In August 2021, MHA National released a report on severe depression. The report indicated that there are 3 counties in Georgia that ranked in the top 20 in the United States for the highest need for depression and crisis care. Dawson County ranked 16th, Lee County ranked 18th, and Decatur County ranked 20th. In an earlier MHA National report released in May 2021 on suicidal ideation, it showed that there are 2 Georgia counties that rank in the top 20 in the United States with respect to counties with the highest level of suicidal ideation in proportion to their population. Lee County, which was mentioned previously, ranked 11th, and Haralson County ranked 16th. This report data was compiled by the MHA Screening Data Mapping Project, where we are able to get information in real time about the state of mental health in the entire country. I wanted to bring this to the council's attention because the data shows that Georgia is trending in the wrong direction. As you have heard, the counties mentioned are rural counties, and a lot of people in these areas are suffering from the issues related to mental health and substance use disorder. And this is only one aspect of the spectrum. We are not even talking about urban areas, low-income households, and health disparities along racial equity lines. Now, how does this relate to parity? It relates because parity is a key to increasing access to mental health and behavioral health issues. Other question, what is parity? There is a federal law that generally prevents group health plans and health insurers that provide mental health and substance use disorder benefits from imposing less favorable benefit limitations on those than on medical and/or surgical coverage. It is known as the Paul Wellstone and Pete Domenici Mental Health Parity and Addiction Equity Act, which was signed into law in 2008 by then President George W. Bush. In the simplest terms, the law was enacted to prohibit discrimination between mental and physical health. I'll give you an example. You have insurance. You go see your primary doctor because you have chest pains. This visit may cost you a $10 copay. All right, no problem. Well, on the other hand, you may be suffering from anxiety and/or depression. Your insurance provides this coverage. Therefore, you go see a therapist or behavioral health specialist, and the visit costs you $80. That's a problem. That $70 difference between cost is discrimination, because insurers are treating physical health and mental health differently. The parity statute was signed into law to prevent that. With respect to Georgia, we have no idea if the state is following federal law. Since the passage of the Mental Health Parity and Addiction Equity Act over 13 years ago now, Georgia has not done anything to determine if group health plans and insurers in the state are following the law. I have a saying regarding parity, and it goes, in states where there is no enforcement, you will find noncompliance. You may be saying to yourself now that, how can you make that determination when we don't even have the data yet, right? Well, it's very easy. It's due to the fact that in states that do enforce the parity statute, we see there is noncompliance with insurers. I'll give you an example. In New York, United Healthcare, the largest U.S. health insurer, recently had to pay a $15.7 million settlement for charges that it illegally denied coverage to thousands of patients suffering from mental health and substance use disorders. The company violated state and federal law by imposing more restrictive limits on coverage and treatment for mental and substance use disorders, rather than imposing those same restrictive limits on physical health conditions. They were even accused of overcharging patients for out-of-network mental health services by reducing reimbursements. This is an example of what happens when a state enforces parity and insurers have to turn over data. In Georgia, we are nowhere near knowing how bad this situation really is. In general, I can talk about problems all day. And quite frankly, I don't like to talk just about problems. I want to find solutions. So there are two things that I believe that can be done. One, as Kim mentioned, is to fully fund mental health in Georgia. And we can all work together to determine what that really means. Two, the General Assembly should create a parity coordinator position within the Department of Insurance under the personnel line item. This role would focus on executing a data call to receive and analyze information to determine where the state stands with respect to group health plans and insurers and make sure that they're complying with state and federal law. Mr. Chairman, we have a lot of work to do to turn this trend in an upwardly direction. Mental health and substance use disorders are skyrocketing in Georgia. The system is broken. We want to fix it, but we need your help. And as I close, I want you to remember this. People are opting out of life and choosing death as a coping mechanism, usually related to an event that is likely temporary. We must do better. And if we all work together, we can do better. So, Mr. Chairman, I appreciate the time today. And I look forward to working with you all and how we can resolve this problem before it gets even worse. Thanks.
All righty. Thank you, Abdul.